Welcome to the WASH in Healthcare Facilities COVID-19 Assessment Tool webinar. And you're about to hear my clock go off because it's just a little bit late in the background. Of course it did. That does not count as an And of course it's 8 o'clock here, so you're going to hear 10 or 16 rings. Okay, so again, welcome to the webinar. Janet, next slide. So I'm Rod Beadle. I am the Senior WASH and Response Advisor. I work with the Health Group and the Global Service Center for Food for the Hungry out of Washington, D.C. Also tonight with us, we have Taiwo Adesina, and Taiwo is Food for the Hungry Senior Relief Specialist with the Relief and Humanitarian Affairs Division, also out of Washington, D.C. And then Rebecca Carney is our Program Officer with RNHA, and also out of Washington. Janet Ozel is a consultant to Food for the Hungry, and she was instrumental in helping us get this seminar or webinar put together. And we also have some special guests. The webinar is intended for Food for the Hungry country staff and regional staff, but we also have some special guests from the World Health Organization and our partners at Engineers Without Borders USA. So Arabella Hyder is on. I think I see you there, Arabella. Would you like to unmute and introduce yourself and just say a few words, Arabella?
Hi there, thanks very much for that introduction. This is Arabella Hyder from the WHO headquarters WASH team. I work specifically on all issues related to WASH in healthcare facilities. I'm very happy to be able to join you today for this webinar. I work with the team, as I said, in headquarters. I'm actually based at the moment in Taiwan, so it's early Friday morning for me. It's great to see the other organizations taking up the use of WASH Fit and adapting it for their own purposes. And I look forward to hearing more through the course of today's webinar about the plans to use WASH Fit and to learn from your approach for training. Just very briefly, so I was part of the team that helped develop the original WASH Fit guide in 2015. And it's seen various iterations over the last 5 years of use and has been used in now over 35 countries in every region from the world. Of course, this new situation that we find ourselves in this year calls for us to adapt and change our ways of working. And I'm particularly pleased to see this simplified version of WASH Fit be developed for use in the COVID setting. So both for preparing to respond to COVID cases and making sure that facilities are able to provide the basic services that they need. As I said, I look forward to hearing more during the course of this webinar, but I'll be happy to answer any questions about WASH Fit more generally, or any of the WHO and UNICEF global work on WASH in healthcare facilities. And just as a quick plug, I'll put a link in the chat box to the global website washinhcf.org, which has more information on lots of different issues related to WASH in healthcare facilities. We have country stories, resources, examples of how WASH improvements are being used and implemented in lots of different countries. So if you haven't already visited that site, I'd encourage you to check it out. And there's space in that website for you also to contribute your own examples of work, experiences, etc. The website's currently only in English, but we're looking to translate it into certainly French, Spanish, and other languages in the near future. So if you're looking for it in another language, please do bear with us for now. Anyway, I'll hand back to the presenters, but thanks again for inviting me to participate, and happy to answer any questions that arise.
Thanks, Arabella. That's really awesome. And we're really honored to have you with us here tonight. And also honored to have Mike Paddock from Engineers Without Borders USA. And Mike and I probably did most of the heavy lifting on developing these tools. So Mike, would you like to introduce yourself?
Sure, happy to, Rod. My name is Mike Paddock. I'm the Chief Engineer for Engineers Without Borders USA. And it really was a pleasure to work with Rod and his team on developing this tool. think it was an interesting mix of taking the knowledge that we've been able to gain from WashFit and then applying it to a rapid response setting like we're seeing for COVID, which has, of course, its unique challenges as many of the countries are locked down. And I really appreciate all of you attending today, 34 participants. I'm sure we're going to learn a lot from your feedback on this particular tool. Certainly feel free to speak up because that's how we make the product even better. Thank you.
Thanks, Mike. And I should mention also that Mike, in addition to being a civil engineer, is also an accomplished author, and he has a book out right now about his experiences building a bridge and water system for a small community in Guatemala. So, Mike, if you get a chance, could you, I don't know if there's a link to the Amazon version or something like that, but that would be great if you could post that in the chat. So.
Happy to. Thanks, Rob.
Awesome. And that was a paid announcement. He actually pays me to say those things. The background of the tool is that Mike and I were talking early on in the COVID-19 outbreak and recognized that WASH and specifically hygiene is really front and center in being able to respond to the COVID-19 outbreak, and also that healthcare facilities are in the front line, obviously, of responding to the outbreak. And so quality of WASH facilities at healthcare facilities is critical to being able to ensure that those facilities become places where the disease is stopped, not where it's spread. And so we looked for different kinds of tools and indicators that we could use in order for our staffs to be able to, I don't know why I have a round circle on my screen, but anyway, we looked for ways that we could evaluate healthcare facilities and came across the WashFit tools that Arabella was talking about, and decided rather than starting from scratch that we would simplify those tools and modify them to respond directly to COVID-19. So that's the background of how they were developed. The purpose of this webinar is for us to share with you all how the tools work and also how to do the assessments and scoring in order to get good results and be able to share data with others. Next slide, please. So a little bit of housekeeping. As I mentioned, we'd love to know where you're watching from, and if you haven't done so already, if you could put your name and country and organization in the chat window. We also ask that everyone keep their microphones muted and their cameras off in order to save bandwidth. We will be taking questions. If you have questions, I encourage you to type them into the chat box, and Rebecca will be compiling those questions as we go along, and we will answer them at the end of the webinar. Next slide. This is our agenda. We're going to spend a few minutes talking about our learning objectives tonight. We're going to introduce the tools and what they're used for, and then we'll spend some time working with the hard copy or spreadsheet version of the tools, just to explain how the indicators work and how the scoring works and how they were compiled. And then we're going to talk about the electronic data version, the Kobo Tools version of the form that Engineers Without Borders developed, and we're trying to deploy across most of our platforms. We will also talk about how we can alter the forms specifically for your country contexts, and use those forms across more than just Food for the Hungry, but also sharing with other organizations and ministries of health in order to get better data consistency across the country. Then for the fun part, we'll do a practice scenario. Taiwo will lead that. And then finally, we'll finish up with discussions and questions. And we do have about an hour and a half allocated for the seminar or the webinar tonight, but I think we'll probably end up a little bit before that. Next slide. I see a pencil. Okay, so our learning objectives tonight are we want to be able to implement the assessment tools using both the spreadsheet version and the Kobo tools form. We want to be able to understand and define each of the indicators that we use in order to score the facilities. And we want to be able to generate our scores for the different assessment areas and an overall score for the facility itself. And then we want to talk a little bit about how we're going to advise healthcare workers and healthcare facility administration on how to use the results and how to address areas that we've identified that need improvement for response to COVID-19. Next slide. So again, we developed the tools using the World Health Organization's WASH Fit tool, and we used the 2018 version of that. We found that it is a very comprehensive tool. It's not just meant for COVID-19, but it's meant for WASH and healthcare across a number of parameters within healthcare facilities from large and small. And it's really a global countrywide kind of tool. So we use the basic format and approach for the tools, but we simplified them, as I mentioned earlier, and we modified them to respond to COVID-19 using the WHO's water, sanitation, hygiene, and waste management for COVID-19 virus guidelines. We use the March version of this year for that. I will point out that those have been modified a few times since then, but I believe all of the indicators have stayed the same. Next slide. So the fundamentals of the assessment tools, again, they were developed to help our country staffs to support healthcare facilities in addressing COVID-19 issues. The tools, Janet, if you could post in the chat box link to the WHO version of the tools. And when she does have that posted up there, it is a Google Drive that we save the spreadsheet versions, and you can pull them up in English, Spanish, or French. We can also develop other language versions on a country-by-country basis. But you'll see that the tools are in spreadsheet form, and they have 6 tabs. And we'll be going over several of these tabs in the next section. The first tab is basic instructions, and I'd encourage you to read those in detail because they really do give good instructions on how to use the tools. The second tab is just general facility information, and that's where we're trying to find out the location, the name, the contacts, the number of staff, and things like that about the facility, just general basic information. And then the next 4 sections are the indicators or the areas that we're most interested in and their indicators, associated indicators. So we start with hand hygiene, cleanliness, disinfection, and personal protective equipment, or PPE. And that, by far, I think in responding to COVID-19, the hygiene component is the most important element of WASH, and that's why we start with that. We then have a tab that evaluates the water for the facility, and then a tab on sanitation and solid waste, and then finally a tab on building and power. And keep in mind that these tools are intended to be shared with your country ministries of health and other partner organizations also conducting assessments of WASH or healthcare facilities in your countries. And if you're all using the same tools and the same scoring and have the same basic understanding, we really think that that brings a lot more strength to the assessment, because we're going to get data consistency. We're going to be able to get a better picture across the broader spectrum of what the actual conditions are and where the most attention is needed. So along those lines, the tools have been adopted by the World Health Organization, as Arabella mentioned, and there's a link to that same website there, washandhealthcarefacilities.org. And you can find the latest versions of these tools there in addition to that Google Drive that we just shared with you. So getting into some of the details of the spreadsheet version, we start with the general section. And again, this is where we get the general basic information about the facility. So you can print these forms out, or you can fill them out on a spreadsheet on a laptop, but we want to know who the assessors are, the dates, any general notes about the facility, the type and size of the facility, the number of staff, maybe a breakdown on beds and inpatient and outpatient seen every day. And then we also, in the lower section, drill down into more details about the kind of wash facilities that are present at the site. So we'll do an evaluation of those facilities, but we want to inventory those facilities in the general section first. Next page. So when we get to the tabs that have the indicators themselves, they have a common layout, and this is shared with the wash fit tools. And we start with the first column, column A, is the numbering for each indicator for that particular section. So here we're within the hygiene section, and our first number is 2.1A. And I want to point out that if you see an asterisk after the number, that means that there are further detailed notes at the bottom of the spreadsheet that give you more guidelines on how to evaluate that indicator. And Janet is circling the asterisk right now. The next column, labeled B, is where we define the indicator that we're evaluating. So in this particular example, we want to evaluate if we have functioning hand hygiene stations available at all points of care within the facility. Then the next three columns, labeled C, are where we define how we score that indicator. So the green would be if it would get a score of 2, meaning that it totally meets the target. And the explanation below that is a simple yes, it meets the target. Yellow with a scoring of 1 means that it partially meets the target. And by the definition for this particular indicator, that means that some hand wash stations, hand hygiene stations are present, but more would be needed. And then the red or 0 score means that no hand hygiene stations are present at the facility. So using those criteria and that description of the indicator and the detailed notes, we then evaluate the score of that indicator for the facility, and we write that score in column D. So in this example, if we had a hand hygiene station at every point of care recommended in the definition, then we would give it a 2. If we had one in one primary care room but not in another, we would give it a score of 1. And if we had no hand hygiene stations available in the facility, we would give it a score of 0. And we'll show you a scoring example in a few slides. Column E is if the indicator score is less than 2, in other words, if we don't totally meet the target, provide details of the problem. So in this example, I might write that the doctor's office has a hand hygiene station, but the primary care area does not. And then column F is where we can talk about what action needs to be taken in order to meet that target at the facility. And we'll talk more about that in a little bit. And then finally, column G is if we return to the facility and use the same form, we can use that to decide if there has been an update to the status of that indicator. So let's say we come back in 3 months' time and we have the old form and we see that it did not quite, it only partially met the target at the time, and we can see why. If that primary care area did now have a hand hygiene station, then we would up the score to meeting the target. But in your initial evaluation, you don't use that column G. Next slide. So we'll talk a little bit about the indicators for each of the 4 areas that we're evaluating. Keep in mind, these are not all of the indicators, but it's kind of the spirit of what the indicators are. I didn't want to go through each and every one. We have 12 indicators for hand hygiene, cleaning, disinfection, and PPE. So with hand hygiene, we're really looking, are hand hygiene stations available? Are they kept full of water? Are they supplied and monitored adequately? Do we have proper hygiene messaging, and is it posted throughout the facility at the right locations? Do we have dedicated and trained cleaning staff? And do those staff members have adequate cleaning materials to keep the area clean and disinfected? Is the PPE available for medical staff and especially for cleaning staff as well? And then finally, has the staff been trained on infection prevention and control? And that we can determine by interviewing the staff. Next slide. For water, we want to know what sort of water supply, if any, is provided to the premises. We can have several supplies at some places and no supplies at others. We also want to be able to evaluate if the water quality is good. Is it adequate for treatment, and does it meet local standards? So that's going to vary by country as to how you do that water quality evaluation. I think some of you are going to want to see laboratory results verifying that the water quality is good. Others may rely upon interviews of staff and more qualitative analysis, but that's going to be according to each country. Is the water quantity sufficient? Right now we define sufficient quantity as 2 days storage, and I think that's consistent with WASH Fit. And then our water conservation strategies being employed in order to not waste water at the facility. Speaking of wastewater, we also want to evaluate the sanitation and solid waste handling at the site. So the questions there are built around the sufficiency of the toilets. Are they in good condition? Are they gender separated? And is there separate facilities for staff and for patients? I will point out that for smaller facilities, I believe the tools don't necessarily require that you be gender separated, if it's just a 1 or 2 room health post, but we still recommend gender separation for both staff and patients. Is there a hand washing station, and is it within 5 meters of the latrine or toilet? Is the wastewater handled safely? So that would be a latrine that doesn't overflow or isn't nearly full or doesn't have a lot of vectors and smells. And then for solid waste or garbage, is that separated within the facility? It's really important in a healthcare facility, not just to separate medical waste from normal waste, but also to separate medical waste associated with infection or infection prevention from other medical waste. Next slide. And then finally, we evaluate building and power. And there, for COVID-19 response, we're looking to see if the building has a separate designated entrance and exit for COVID-19 cases. Does it have waiting areas where we can practice appropriate social distancing? And do those waiting areas have appropriate messaging, both for hand hygiene and for COVID response? And then finally, does the facility have sufficient and reliable power? Is it continuous power during hours of operations? And is it sufficient to be able to run all equipment on the site? One thing we want to talk about, again, I mentioned earlier that we can modify these tools on a country by country basis. And I think that that's entirely appropriate because the context is going to be different in one place versus another. And also note that many of the indicators are very general and not, we do have definitions of the indicators, but we sometimes don't go into great detail on that. And that's on purpose. So for some of the indicators, they're going to be, those evaluation criteria are going to be influenced by national regulations, best practices in the country. And in some places where you see the words reliable, available, regular time period, we really encourage the country offices to develop with your enumerators and evaluators before they go out into the field, develop a common understanding of what you would consider to be reliable, available, or regular. So a good example is if the evaluation criteria, the indicator is staff regularly monitor hand hygiene stations. Well, for some facilities, that might mean checking once in the morning to make sure that the hand wash stations are full of water and have soap, and then checking again at the end of the day. In others, it may, more busy facilities, it may require that you be monitoring and checking, on an hourly basis. So again, that's going to be up to individual countries to establish those criteria. So we're going to go over the scoring, and this is the very last tab. I lied, I said there were 6, but there's really 7 tabs. The last tab is the scoring tab, and this is where we score the facility for each of the areas that we've evaluated. So what we do is we fill in the number of indicators in the first column in the groups of rows, the number of indicators under that particular area that we're evaluating. Now, in the base survey, or the base tools, we have 12 indicators for hand hygiene, cleaning, disinfection, and PPE. You may have a different number if you decide to either add indicators or remove indicators from that list, which is why we don't fill that number in until we're ready to do our evaluations. But in this case, we have 12. Now, let's say that of those 12 indicators, that 3 of them meet their target. So we would write in the percentage column for that assessment that 25% meet the green or the number 2 category, 3 out of 12. Now let's say that 6 of them partially meet. They don't fully meet, but they do partially meet the indicator requirements. So 6 out of 12 is 50%. And then finally, the remaining 3 indicators don't meet their criteria at all, and so they score 25%. So you can see how this becomes a very powerful tool for us to be able to evaluate this facility versus other facilities, and specifically areas within this facility, to see how ready they are for COVID-19, especially in comparison to other facilities. Now, we can do the same thing for water, sanitation, building, and power. We've pre-populated those so that we won't spend too much time going through them, but you can see for water, we have 6 indicators. For sanitation and solid waste, we have 8, and for building and power, we have 6. And then once we've done the scoring for all 4 of those areas, we can do an overall facility score. And that's simply a matter of adding up all of the indicators for the 4 areas being evaluated. So in this case, 12 plus 6 plus 8 plus 6 equals 32. And so of those indicators, we count how many are green, yellow, and red, calculate the percentages, and write them in the form. So we see that this facility overall conforms and meets the targets for 31% of the 32 indicators. 41% needs some work in order to get to that meets category. And 28% are not present or don't meet the indicators at all. So again, a very powerful tool to be able to compare this data with other facilities. I just said, I guess that counts as another one. Next slide, please. So I also mentioned that we would talk about action to be taken later. And I want to be very careful with this because I think that we want to keep in mind that we are not healthcare officials, and we don't work for the Ministry of Health. And so it is not incumbent upon us to tell healthcare facilities what to do in order to get ready for COVID-19. I would liken this very much to water testing, where I don't always share results of my water testing, especially when I don't see problems, because I don't want to give a false sense of security to people, given that I'm not doing my testing using official laboratory conditions. So the same with this. We're not healthcare professionals, so it's not up to us to tell healthcare facilities what to do, but we should share with them the actions that we recommend be taken in order to get their facilities ready for COVID-19. So you just want to be really careful with that. And there are some recommendations or suggestions here that, you know, if the issue is that there just aren't enough posters about COVID-19 within the facility, well, there's nothing that prevents your team from, well, there probably is nothing that prevents your team from bringing those posters with them and sharing them with the facility and bringing them up into conformance. So. Oh, and we also want to make sure that when we recommend actions that they are actionable items, that it's something that can actually realistically be done to bring the facility into conformance. Okay, as I mentioned earlier, that's the spreadsheet or printed version of the survey. We also worked with Engineers Without Borders, and they made the Kobo Toolbox version for us. Kobo Toolbox is a tool that collects data using a mobile phone, laptop, or not pad, but tablet. And the really powerful thing, it's a really powerful tool, and we'll go over some of the basics of it. And later on in the presentation, when we go through the example, we'll show you how it's actually used and give you a link so you can practice with it too. But the first thing you do is you click this link that Janet has put into the chat box, and that brings you to the survey. Note that you can use the survey without having to log in to have a password or anything like that, as long as you have the link. And this link is to the Food for the Hungry practice version of the Kobo Toolbox. So you can't do any harm by using it and entering data. So I really encourage you just to play around with it all you want. I'll know that it's not good data and try to apply it someplace. The first thing you will see when you start to fill your form out is you have the choice of the 3 languages, English, French, and Spanish. And we will be developing and providing Kobo Toolbox versions of this by individual country. So we can also see about modifying it to use language like Amharic, if that's possible. Next slide. So you also, another thing that really makes Kobo Toolbox really powerful is the fact that the form works offline. So as long as you've downloaded it to your device when you have a data connection, you can go to the healthcare facility, and even without a cell phone signal or data, you can still collect data on your device. And it will save it on the device and then upload it once you have a strong connection. And you can see in the upper left-hand corner under the strength bar that it shows you how many records you have stored on your device that have not yet been uploaded. So right now that looks like there is 0 on there, but if there is 1 or 2 and you had good data and were ready to upload it, you could hit upload. That upload is going to go to your country central office database, where all of these assessments will be uploaded and evaluated by the administrator, which we'll talk about in just a little bit. At the bottom of the form, once you've finished filling it out, and again, we'll be going through an example of this, you have 2 options. You can save the draft, or you can submit the form. We really recommend that you save the draft. If you're going to be doing, say, 5 or 6 assessments in a day, and you realize that the first 2 you didn't do something consistent with the later 3, you can always go back to the draft and update or modify your scoring or your notes or something like that. And then hit submit again once you have a signal or once you have data. But we do recommend that you save your drafts and then just do a single upload. And there's, again, you click on the queue and hit upload, and it goes to your administrator for further data processing and evaluation. You can see in this particular case, we have 2. The first one is called Healthcare Facility Alpha, and the second is Beta. And once you hit upload, Alpha and Beta go to the central office. Keep in mind also that Kobo Toolbox is really a data collection platform. It's not a data management or display platform. So we have a lot of options on how we manage the data, everything from a spreadsheet to very powerful database programs and geographical information systems. But this is just one example of what is being done in Guatemala, and the FH Guatemala office is participating in this, where in this example, they're using Power BI database to graphically display data on 40 assessments that have been completed. And you can see they're all northwest of Guatemala City in Guatemala. And in the particular tab that they have highlighted now, they're showing the different types of facilities that have been evaluated in that country. So we're asking every office to designate an administrator, every office that's going to be doing these surveys to designate an administrator. That may be an IT person, it may be someone from M&E, or it may be a health person, but someone should be in charge of the overall data administration, and we will provide further training to that person for how to collect and validate and store and share data, and how to do that with other partners in country as well. So if you're not tired of hearing my voice and you haven't been able to count all of the uhs, you're pretty much done, because Taiwo is going to take it over now and give us the fun part where we do the practice scenario. Thanks, Taiwo.
Awesome. Thanks, Rod, for that overview. And I also just said, so we are going to walk through a practice scenario, but before we get into that, I do want to encourage you to use the chat box to ask any questions. I see that some have already been asking, and we will address all of your questions at the end. And also wanted to remind you as well that the webinar is being recorded. So if you do need to go back for a refresher, we will be sending this out to you. So right now we are going through a practice scenario to practice everything that you've learned about the tool. Janet is going to be adding a link to the scenario into the chat, but it will also be displayed on the screen. So if you are not able to do both at once, that's fine. You can just follow along with me on the screen. So we'll walk through a fictional scenario and providing some of the WASH specifics of a healthcare facility in South Sudan. Again, it's all fictional. And then we'll ask you to, using a poll, to fill out the tool for the second section of the assessment tool, which is the hygiene, cleaning, and disinfection section. And we're using the poll so that this is an interactive experience for you, and it can be a little participatory. Again, it's fictional, and I will just encourage y'all to participate. When you fill out the poll, there's no way for us to know who said what. It's just a way for you to familiarize yourself with the indicators and how to respond to them. So I'll read through the scenario. Your team is assessing a clinic in Lafon, South Sudan. A diagram of the clinic is shown below, along with the pictures of some other facilities, and we'll show that in the next slide. There are 2 nurses that staff the clinic. You interview head nurse Sarah Akel for information. 1 doctor comes to the clinic 1 day a week. All serious cases are referred to the hospital in Torit, 50 kilometers to the south. Given the relatively rural dispersed living conditions, it is anticipated that there will be a 25% increase in outpatient visits due to COVID-19. The healthcare facility has received some materials and PPE from the Ministry of Health, including posters for hand washing and COVID-19 risk communication materials. They've also received soap, mops, buckets, and chlorine, medical gloves, cloth gowns, medical mask, goggles, but no boots or heavy-duty gloves for cleaning. Both medical staff and cleaning staff have been trained by the Ministry of Health on COVID-19 knowledge, risk, and prevention strategies. The clinic has a generator that can power equipment, but they often lack petrol to run it. Cleaning staff make rounds twice a day to fill hand washing stations, clean and disinfect surfaces and toilets, and remove waste. So on your screen, you should see the clinic layout for the clinic that I just described. At the north of the clinic, or the top of the page, is the patient treatment area, and the bottom part is the waiting area or the triage area where you would first walk into. In the back of the clinic is the latrine and the burn pit. To the right of the page is the key. So you have the borehole in the front. The circle with the cross through it, the white one, is the hand washing stations, or the hand washing stations. There's one drinking water station. Again, the latrines to the back of the clinic. The green stars represent hand hygiene messaging, and the blue stars represent COVID-19 prevention messaging. And there's no need to memorize this or the narrative that I just read. We'll project it so you're able to answer the poll. Okay. And here are just some images. Starting from the left is the image of the borehole in the clinic. The image in the middle are the latrines, and to the right we have the burn pit. Great. So we're going to go into the poll again. So the poll is, the questions in the poll represent the first 4 indicators. We're going to go through 4 of them. The first 4 indicators for the second tab of the assessment tool. Again, that's the hygiene, cleaning, disinfection tab of the tool. So indicator 2.1a, and you should have that on your screen right now. It says functioning hand hygiene stations at all points of care. And again, you have that image of the clinic layout, so you can look and see, are there functioning hand hygiene stations at all points of care? And then you're going to want to indicate if it meets the target, partially meets the target, or does not meet the target. And I'll give you guys a minute to do that. Okay, I'll give you guys another 20 seconds. Another 10 seconds. Okay, let's go ahead and close the poll. So the indicator was functioning hand hygiene stations at all points of care. Most of you said it partially meets the target. A couple of you said it meets the target, and then 3 of you said it does not meet the target. So for this one, it does not meet the target. And that is because if you look at that clinic layout on the screen, the point of care is the patient treatment area. And as you can see, there is no hand hygiene station there. So it does not meet the target. And this is pretty important to distinguish the waiting area, the triage area, from where doctors or nurses or other clinicians are actually seeing patients. Because that room they take you to where they consult with you is where you want that hand hygiene station, because that's where the clinician is coming into contact with the potential COVID-19 case. So you want to make sure that in addition to having the hand hygiene facility in the waiting area, you have it in the treatment area as well. And those are two separate indicators on the assessment tool. So great. Let's go ahead and close that out and move on to the next one. I hope you're beginning to see the rhythm of this. Can we move on to the next poll? Okay, perfect. So the second indicator, functioning hand hygiene stations are available in all waiting areas. I'll probably give you guys about a minute for this one. Again, please don't feel shy to respond. We can't tell who is saying what. I'll give it another 20 seconds. Only half of you have responded. Okay, let's go ahead and close it out. So the indicator was functioning hand hygiene stations are available in all waiting areas. Most of you said it meets the target. Some of you said it partially meets the target. 5 of you said it does not meet the target. So once we go back to the layout, we see that in the waiting area, there is indeed a hand hygiene station. So it does meet the target. That is correct for that one. And now we'll move into the third indicator. The indicator reads hand hygiene promotion materials clearly visible, and understandable at key places. So hand hygiene promotion materials are clearly visible and understandable at key places. I'll give you another 20 seconds. Okay, let's go ahead and close the poll. The indicator is hand hygiene promotion materials are clearly visible and understandable at key places. We know from the clinic layout that the green star represents the hand hygiene messaging. So for this one, it does meet the target. So most of you were correct in that it does meet the target. One thing that we do want to be sure of is to use your best judgment when you're doing the assessment. Obviously, if you have a very large facility and you see only one tiny hand hygiene messaging poster, then maybe it's not enough and maybe it doesn't meet the target. So there are some of these indicators where you're going to have to adapt it to what you're seeing on the ground. Okay. Let's go ahead and do the final poll. So the indicator is COVID-19 risk communication materials are posted at key places. Give it another 15 seconds. Okay, let's go ahead and close the poll. Right, the indicator is COVID-19 risk communication materials are posted at key places. Most of you said it meets the target, and this is correct. So when we go back to the clinic layout, we are looking for the blue star, and it is posted. We can see that we have 4 of those in the facility. I do want to go back to the previous one. My apologies, I did make a mistake with that one. And some of you have noted that in the chat. It did not meet the target because we did not have hand hygiene messaging at the latrines in the back. So you are correct. There should have been a green star in the back next to the latrines. So that was a test. So you passed. Awesome. So let's go ahead and close out of the poll. So we're only going to practice with those 4 indicators. Obviously, there's more. And what I want to do now is just walk you through the Kobo tool so you can see what it looks like when you go in. Once you're in, you are going to see the instructions first. And these instructions are the same as the same things that Rod has gone over with you, how the tool was developed, and it goes into the four different tabs. In the steps section, it walks you through how to complete the assessment. And then you get into general information. So for the first, part of the general information section. Okay, I see. Sorry. We are pulling up, okay. We are pulling up the one we already pre-populated, so you can see the data already in there. And this pre-population, obviously it's fictional. And again, it's based off of the scenario that I read to you that we just went over. So the first section is the general information, and it has the names of the assessors and their contact information, the date the assessment was conducted and the time. The next section is the facility information, and you have the name of your facility and where it's located. If you are doing this in Kobo Tools, it will automatically populate the GPS coordinates. But if you are going to be doing this by hand, then that's something you might want to consider, maybe looking on your phone or some other gadget for the coordinates and filling that in. But if you're doing it in the tool, it will do that for you. Next it asks for information on the number of staff, the doctors and nurses, number of inpatients, and the number of beds. It'll also ask for the average number of outpatients per day, and you would get this from the healthcare worker or facility staff person that you are asking or engaging with. The next one is the expected COVID-19 % increase of patients. So what is the anticipated increase rate? Next is the type of healthcare facility. Is it a hospital? Is it a clinic? You would want to indicate that. And then the contact name of the individual at the facility and their contact information. The next piece of the tool looks at the facilities present. So if there's a kitchen or triage area or waiting area, you would want to indicate that here. Next, it asks about how the facility is powered. Here we have generator and other, because our facility in our scenario is also powered by candles. But you will find that some facilities might use solar in the day, then generator at night. So you are able to select more than one option. Solid waste treatment, how are they getting rid of waste? If it's more than one way, you can indicate that as well. And then also the water supply. And if they are doing maybe something different in the dry season or something different in the raining season, you can indicate that. And for each of these, there is a note section where you can provide details as well. The next section, we're looking at sanitation and hygiene facilities present at the facility. So here you want to indicate the types of toilets or latrines, and also where the hand washing stations are and how many there are. Then we get into the second tab, and you should remember that this is the tab that we worked on: hygiene, cleaning, disinfection, and PPE. So the first indicators, the first 4 indicators are the ones that we went over together. The hand hygiene station, looking at if hand hygiene stations are available in the care and waiting areas, and also the hand hygiene promotion materials and COVID-19 risk communication materials. For some of the indicators, you will see small italicized writing underneath, and those are just descriptions of the indicators to help you understand what you should be looking for. So the next indicator that we didn't go over was soap and towels or alcohol-based hand rub supplies at all hygiene stations. And based off of the narrative that I read to you, we said that that meets the target. The next is hand washing stations are kept full of water or are supplied by piped water. We said it meets the target because in the narrative we saw that staff were constantly checking to make sure there was water in the stations. The next is Hand washing stations are full and kept of water. Staff regularly monitor hand hygiene stations for adequate soap. We said it met the target. 2.7, an adequate number of dedicated trained cleaning staff are available. And again, the description of that is provided. And for our scenario, it met the target. 2.8, appropriate and well-maintained cleaning materials are available. And we said that it met the target as well. 2.9, appropriate PPE is provided for staff. Yes, this meets the target based off of what we learned in the narrative. 2.10, heavy duty gloves, mask, goggles, or face shield. Face shields, long sleeve gown, apron, etc. are available. For this one, it does not completely meet the target. If you remember from the narrative that I read, I had mentioned that they don't have boots. So it partially meets the target. And for this indicator, we are aware it says some, but not all are trained or training is not adequate. This is a mistake and it will be changed. So that indicator or that option should be referring to the availability of PPE, and that will be changed. And then 211, healthcare personnel new to the facility receive training, and we said this meets the target. And then as you can see, the score for that section is indicated 21 out of 24. I won't go into the indicators for the other sections, but again, these are the same tabs that Rod walked us through: water, sanitation, solid waste, building and power. And then at the bottom is the final score for the facility. And in this scenario, it's 40. And back to you, Rod.
Great, thanks so much, Taiwo. That was really great. I want to point out that the scoring that we use for the spreadsheet, where we summarize results in the 3 categories of meets target, partially meets, or doesn't meet, is different than the scoring that's used in the Kobo Tools version. The Kobo Tools gives you a single number using the values of the evaluation criteria, but it is a little bit different in how that calculates from the spreadsheet. Also, as Taiwo mentioned, we found a few things as we were going through and preparing for the webinar that need to be corrected on the spreadsheet versions and the Kobo Tool versions, and we'll be getting to those revisions and sharing those in the next version issue as well. And then I really encourage the country offices individually reach out to me if you have any further questions that we don't answer tonight, and also to start to coordinate deploying these surveys. It would be really interesting. In fact, I wish I had done a poll on just how interested people are, or how likely people think it is in different countries to be able to use the electronic version, the Kobo Tools version, versus if you think you'll need to use the printed version. But we'll work that out on a country by country basis. So, so yeah, for our last section, we are going to talk about the questions that we've received. And not a lot, but the first question is, do the indicators all have the same weight? And that's a really great question. And I think it's one of the things that I would love to try and address, because some indicators are more than likely more important than other indicators, and yet they all have the same weighting in the way that we do the scoring. The problem is that the devil's in the details when you start to apply different weighting to indicators, and it starts to really complicate the analysis. So for now, they all have the same weight. We recognize that that's not an ideal way to do a scoring, but we're really looking for relative values between different facilities in order to be able to compare regions and facilities and needs, and really trying to identify, are problems related to hygiene? Are they related to PPE? Are they more related to water and such? So, so right now they do all have the same weighting. The second question, in a situation where lockdown or work from home is applied and staff are unable to go to the field and conduct direct observation, is there any example or good practice to do this assessment remotely? And yes, there is. We did develop the tools. Again, we tried to make them as simple as possible so that if someone with minimal training were to fill them out, ideally they would still come up with a pretty close to the same score that you would with this training. But we also use the example, we did a trick question on the first one where we asked if there are hand hygiene stations in or points of care, just again to emphasize the fact that you really need to read the whole indicator and understand, am I only looking at points of care? Does that include the waiting area? Does that include the latrines, et cetera? So the intention is that you would be able to send this survey to healthcare workers in places where you're not able to travel to and have them fill it out. But the practice has been, and we've got some experience with this in Guatemala now, and one of the organizations, the partner organizations that's doing these evaluations, has had a lot of problems with you providing the survey to healthcare workers and getting back inconsistent or unusable data. So it's not perfect, but I would recommend that if you do go that route, that you at least communicate over the phone with the enumerator or the person who's filling out the survey and be available to answer any questions they have so that we aren't wasting their time and ours in collecting the data. Other questions that came in afterwards: are we allowed to use Kobo now, knowing that the LNE guidance said we only allowed to use ODK? And that's a great question. I don't know if I really want to answer it out loud, but we are presenting the Kobo Tools version because of the fact that that's being shared by World Health Organization, Engineers Without Borders, and being used almost universally by our partners. We have the option, and we can do this on a country by country basis also, of converting the Kobo tool to ODK. I'm told by Subodh that that's a relatively easy thing to do. We've just stuck with the Kobo tools just for consistency with everyone else, but stay tuned on what we do with the ODK. Suggestion on the scenario picture: add in key location description. I'm not quite sure what that means. Taiwo, do you know what that means? Or Janet?
Can you repeat that?
Suggestion on the scenario picture: add in key location description.
That might be for the definition of the indicator, I think.
Oh yeah, that would be a good idea. Yeah.
How are we defining key locations? That's a good point.
Yeah, very good point. And then next question, suggestion on the scenario hand hygiene question: it is recommended to also have hand hygiene promotion within 5 meters of the toilet too. And yeah, I think we circled back to that one, that was incorrect when we said that it was conforming specifically because it did not have that hand hygiene promotion near the toilet. Is that it? Let's see.
I might add, Rod, that I think a few places we noted there were a couple of typos or issues. I think also in a couple of the key definitions, those will be updated to make sure that those are clear and accurate as well.
Yeah, and then Arabella, in the last entry, points out that the WHO is really interested in learning about our experiences using the WashFit tools, and that we can get in touch with her through her email. And I have that email also if you need it, and also through the WASH and HCF. Actually, it's an email address, washandhcf@who.int. So yeah, and we've talked about this as we develop these tools. We are implementing them in Guatemala, and we're just starting to roll them out in a few places right now. So as we start to do that, let's definitely share with the WHO how it's working. They will also be maintaining and modifying their versions of the tools. So we'd really like to share any, when we find mistakes or when we find issues and problems, so that we can share that with everyone that's using them. So, yeah, and I think that's it for the questions, right, Rebecca? I don't always see all the questions when I'm presenting.
Yeah, that was all of them. Thanks, everyone.
Okay, awesome. Yeah, and then my email is at the on the last slide. If you have any questions or comments, I'd love to hear them. Hopefully we start to see some great results from rolling these things out. And again, I really encourage the country offices to contact me so that we can start to get you set up in Kobo Tools or ODK and get these things going. So thank you so much, everybody.
Thanks, everyone.